Hello, my name is Albino Hilera. I'm a nurse practitioner for the palliative care team. I've been here at Medical Center Hospital for about 20 years. I've used to work at 6 Central, Intensive Care Unit, Interventional Radiology, and now with the palliative care team. I was born and raised in the Philippines. I came here in the States back when I was 22, and that was back in 1995. My first work assignment was in McAllen, Texas. I stayed there for about 6 months, then made my way to Laredo, Texas, and I stayed there for another 6 months, and finally came here to the Midland, Odessa area. I went ahead and started working at Medical Center Hospital back in 1996, and I'm still here. I am married for about 20 years. She is a NICU nurse. Her name is Amy. I met her here in Odessa, and so we fell in love. And so begins the story. I have 2 beautiful kids. One is 18 years old, and the other one he'll be 12 this coming March. The palliative care team takes care of a lot of patients. We had this patient that was in hospice, and so she was a 45-year-old female that had breast cancer, and she was under what we call a GIP hospice until such time when she was able to go home and had to be taken care of by her family. January the 4th, it was my second day with the palliative care team. I went ahead and visited them at their house, and so when I was talking to her, she told me, "Albino, I want to get married." And I said, "Okay." So I just took that with a grain of salt and then just left it like that. That Friday, which was January the 6th, I went ahead and talked to her husband, and I said, "What is this business about, trying to get married?" And he said, "Well, we've been together for about 30 years, and I think what she wants," and from that point on, I said, "She wants to renew your vows." So I told the husband, "Well, let's do it." And so I made the arrangements. I called her daughter. I went ahead and asked the help of Pastor Doug and some of my friends, Ryan and Faith. And I made this invitation. And then after that, I went to visit them again Sunday, which was January the 8th. As I was there, I've noticed that she was breathing a little bit slower and shallower. She was breathing about 5 to 6 breaths a minute. And so I said to the family, "I think we need to get this wedding vow renewal a little bit sooner." We tentatively scheduled it for January the 14th, so I told them, "Let's move it to January the 9th. It was the next day. So I said, "Well, let's do it." So the next day, which was January the 9th, we went ahead and had the wedding vow renewal planned, and we executed it. And we executed it perfect. The family was so happy, and they were so grateful that, we went above and beyond our call of duty to facilitate this wedding vow. And to me, I've been nursing for almost 24 years. And to me, that was the most profound moment so far of my career. And I will remember that day when she told me that this was good. When I was doing interventional radiology back then, every time I would get the chance to do a thoracentesis on Rocky, her name is Roxanne. Before I would go into the room, I would ask the tech that's going to be with me for the procedure, like, "Who's in here?" And they would say, it's Rocky. And so every time I would go in the room, I would start singing, "Roxanne!" And she would just blurt out laughing, even though she was so short of breath. And to me, it made me think like it was music. It was music to her ears to hear me say, "Roxanne!" And so I said, she must really love music. And what brought me to being in the position right now where I'm at has made me think, music therapy, to me, plays a very important role on patients that are terminally sick or terminally ill. And so I think with the position that I'm in right now, I can pretty much formulate the program, tailor it to what the patients would benefit. And so last week, I went ahead and initiated a music ministry, or you would say a music therapy. And so I myself, Ryan Baldomero, Faith, and Pastor Doug, we would go into the patient's room and then sing some songs to the patient live. So I would joke to my patients, like, this is one of the perks of being on the palliative care floor, is you're going to have music therapy, and it's not going to be coming out of a boombox or an iPad, but it's going to be live. So this is a treat for you. So that has encouraged me to pursue this program for the palliative care team, to have this music ministry or music therapy. And I think numerous studies have said or have concluded that music really plays an important role in a patient's life, that it is either they're terminally sick or just in need of a song. Well, I've been here 20 years, and I think if I'll be given a chance, I'll be here 20 more years. And so I would just like to thank Medical Center for giving me the opportunity to work here. This is a very good facility. My daughter, who is graduating from high school, is going to work here. And so this facility has been good to my family. There's about 13 or 14 of us that are employed here. And so you can't talk bad about me.